Dispensing anti-malaria drugs. This has become one of Mildred Nakanwaji's main duties at this hospital. She says the number of patients coming in with malaria symptoms is high.
The frequency is really big because there is a lot of malaria within the tropics. That is the disease which really disturbs us.
Like Florence Kana, many other people continue to battle bouts of malaria. Kana is here for a checkup after days of treatment using artemisinin, an anti-malarial drug discovered in China.
I came here at the hospital and the doctor prescribed it. And when he prescribed it, he gave me the artemether dose. When I took it, I didn't have any side effects and I recovered.
Uganda is one of sub-Saharan countries still struggling to battle with malaria. Over the years, Uganda has used a number of anti-malarial drugs, but many of those have since developed resistance. The introduction of artemisinin has gone a long way to treat the disease, which is the #1 killer of children below the age of 5 in Africa. World Health Organization statistics indicate that close to 200 million people are diagnosed with malaria each year, and malaria transmission rates are substantially greater in Africa than any other parts of the world. Medical personnel believe the use of artemether has been effective in reducing the risk and delaying the recurrence of malaria among patients.
Artemether lumefantrine, which is commonly called Coartem, is very effective. We use the test and treat protocol where if a person is tested positive for malaria, we use it. It's very effective with very mild side effects, and the patients like it.
While artemisinin-based combination therapy is currently recommended for the treatment of malaria, Uganda's health ministry is strengthening its plans to effectively combat malaria.
We continue to have efficacious medicines, and actually China does a lot of work on that. They give us their medicines, ACTs, and then we could continue to have the mosquito nets. We could also continue to do indoor residue, but covering the whole country.
Currently, the reductions in malaria-associated death in Uganda have been attributed to the highly effective artemether combined therapy. But experts warn that the emergence of resistance to the artemisinin anti-malarial drugs would pose a major global health problem. Hilary Esiga, CCTV, Kampala.